Principles of sports nutrition.
On this tutorial, I want to discuss the various health problems and risk factors that have been identified in people, in individuals, in athletes who use anabolic steroids and a whole variety of doping agents. The side effects range from physiological and structural to psychosocial to mental and emotional. Side effects from using anabolic steroids include emotional addiction, paranoia, roid rage, lowered immune response, testicular atrophy, and sterility. Females who take high doses of testosterone for prolonged periods of time risk virilization, or symptoms that make them feel or look more male-like, irreversible enlargement of the clitoris, and menstrual disturbances. Now, these are health problems. These are detected through medical investigation, and these things have all been verified by patients who come and seek medical attention because of these health problems. Steroid use for performance enhancement is illegal, banned by the IOC, and is now considered unethical by the medical profession. So to get your steroids, you have to buy them on the black market. You can no longer go to a pharmacy after seeing a physician who has given you a prescription for testosterone or growth hormone if you are an athlete planning to use them to enhance your performance. So you have to buy them on the street, on the black market, and right away we know there's going to be a loss of quality control. So to me, that's part of the main risk. I don't like to buy anything unless I have a way to verify its quality and composition. And unlike a bag of pot, which you can smell and look at and determine whether or not it's real, you can't really tell by looking at a vial or ampule of clear fluid whether or not it's actually the real McCoy. Now, it's up to the individual to make the decision to do or not to do, to cross the line or not to cross the line. But when you do, in my experience, is that there is a very high risk of addiction to the benefits associated with steroids, and that is what puts the athlete in a position of high risk. They want more, they feel great, they build size and strength, they're able to run faster, and even though they know it's illegal and they would never tell anyone, and they usually hide the fact that they're taking steroids, they want the benefits, so they continue to take the substance, and you have to increase the dosage, and eventually you get caught up in stacking and doing a whole variety of different cycles and adding this to that to compensate for this and that, and it gets really kind of wacky. But anyway, here's a short list for any of you that are on the edge, that are on the fence, thinking about taking these substances. And we're not talking about medical intervention. We're not talking about the man or woman who has had a heart attack or has been in a serious accident or is perceived by a medical professional as being a candidate for taking an anabolic steroid to help them recover in a process of convalescence. No, we're talking about athletes that are well, who essentially want to cheat and take substances to enhance their performance in sports that don't allow them. Or there's another group of people, a group of individuals that perhaps more so than the athletes, I would say that overall there's millions of people that never compete, never play sports, but they go to the gym. They're firefighters, they're police officers, they are celebrities. For a whole variety of reasons, they're taking steroids to pump up the volume, to make themselves look like something they're not actually, and to enhance the process of their goal or objective, which is to make themselves look better. And essentially what I've seen also is that most of these people have no idea how the steroids work. They don't understand the chemistry, and they don't really care about that. What they want are the benefits, and for whatever reason, many of them think that they're going to live forever and not experience the worst, let alone the least, of any of the symptoms I'm about to mention. So once again, here's a short list. emotional addiction, ego alteration, steroid psychosis, paranoia, violent behavior, reverse anorexia nervosa, high cholesterol, heart and artery disease, high blood pressure, lowered immune system response, frequent colds and persistent infection, testicle shrinkage, reduced sperm production, sterility, virilization, change in skin texture, irreversible enlargement of the clitoris, hair loss, menstrual disturbances, increased fatty breast tissue in men, known as gyno or gynecomastia, formation of calcium deposits deep in the muscle belly at the point of injection, abscess formation, and infection, acute and chronic acne, prostate and urethra infection, enlarged prostate, kidney and liver toxicity, a criminal record, incarceration, damaged reputation among peers, associations, and the world. Case in point, Lance Armstrong. Stunted growth, reduction of serum lipoprotein A, up to a 25% increase in the size of the heart's left ventricle due to edema and swelling of the mitochondria, reduction of high-density lipoprotein cholesterol and elevation of low-density lipoprotein cholesterol, increased risk of blood clot formation, bouts of depression and anxiety, panic disorders and paranoid delusions, increased aggression, hyperactivity and irritability, manic episodes, suicidal thoughts, auditory hallucinations, and dependence on the very substance that is causing these symptoms, in conjunction with the so-called wonderful benefits that they seem to attribute to their fascination, continued use, and worship of. The risk of side effects is relative to dosage and frequency of use. It's very similar to alcohol consumption or smoking cigarettes. The more you take and the longer you take them, the greater the risk of damage. Biochemical individuality and strength of constitution is a major factor in terms of how the drugs affect each individual. If somebody has a weak constitution and takes the wrong combination, serious side effects may occur. On the other hand, if somebody has a strong constitution, obtains regular blood and urine analysis, takes vitamins and eats well, the risk of toxicity is lower. However, like many recreational drug consumers, steroid users typically don't eat fresh, whole, organic food exclusively or take supplements. The mindset that attracts people to using steroids, knowing how it's perceived by athletic associations and the IOC and society at large, that kind of person generally does not have their own best interests at heart. They're either unaware of the risks, they prefer not to think about the risks, or they're convinced that somehow, some way, they're going to escape all of the risks because for whatever reason, none of the risks apply to them.